Hi guys, it's Etu from Do Marketing here, and today we are at Dr. Fuzani's practice Kalaway Mtata, and as we all know that it's Breast Cancer Awareness Month. As you can see, I'm also wearing pink for the presentation. Basically, we're here to learn about breast cancer, whether it's risk factors and preventions, screening and diagnosis, treatment options, personal experiences, and support and resources. So let's not waste any time and let's get to it. Dr. Fuzani, thank you so much for having us today. I would like you to answer a few questions that are related to breast cancer. The first one is, what are the most significant risk factors for breast cancer and how can they be mitigated?
Okay, I'll say I will have to greet you first. You're speaking to Dr. Luvuyo Lulama Fuzani from Lusigisi, Emantusini, Changisa Belongo, Scomingos of Mlajan, Bohemian was short in the Duamas, and this was business in Yagotuagas. But yeah, I hope whatever we're doing is going to help someone, because we want to make sure in this month of breast cancer awareness, we make sure that abantu bayazi ukuthi what is breast cancer, yenza ntoni, and bangaphi abantu abathatha ebomini okanye bangaphi abantu ethe make sure ukuthi yenza ubomi babo bube difficult. But what we want to do is like we have to go into a good strategy of making people aware of what is breast cancer and how to make sure that people are aware that what are the early symptoms, what are the risk factors, as you asked. How can they make sure that they don't go through to the last stages whereby stage 4 is like that, you know. Then now to answer that of what are the risk factors and how to mitigate them. First thing, I think it's good to just give an overview of the epidemiology of this problem. I don't know if it's fine. If we can we go and give us epidemiology? How is this? Because there is a study that was done by one of our great surgeons here in Nelson Mandela Academic Hospital, which is Dr. Malonga, about the incidences happening all over the world, in South Africa, even here in our Transkei, which we say is a Transkei because Nelson Mandela Academic Hospital affects Transkei, like it serves the Transkei, you know. Then I would like to give some small information before we go to the risk factors. Is it fine?
Yes, doctor, it's fine.
It's fine. Okay. When it comes to worldwide, around the study that was done in 2008, there were about 2.1 million cases of breast cancer, you know, and about 630 mortalities, which is people that they lost their lives through such, you know. And here in South Africa, we've got about 27,000 amongst women, 16% of cancer deaths, you know. Then in Nelson Mandela Academic Hospital alone, in 2008, you know, the study that was done, like, which is our population here in Transkei estimated is about 6.5 million. The whole population, including male and females and children. Then estimated about the cases that were seen at general surgery involving oncology, which is oncology side, which is the cancer side there. It's about 211 only in 2018, 211, making 8 males versus 203 females, which is 96% is females, about 3.9 they were males, you know. When we talk about breast cancer, people, they think it's only for females, you know, which is, it's not, it's just a myth. Even males, they get affected by such things, you know. And the age average was between 25 and 80, you know, because there are things whereby we are going to talk about risk factors whereby we say it's more high risky when you're above 40. Okay. Then that was just an opening so that we can understand what is actually happening in our environment about this breast cancer so that everyone can be aware of it. Then when it comes to risk factor, we like to define them in two ways of your risk factors. There are ones whereby you cannot do anything about them. They are part of you. They are part of you, and there are ones whereby you can do something about them, you know. We've got hormonal and non-hormonal ones, you know, and we've got those modifiable, you know, let's say that, whereby there is something that you can do, you know, and they are non-modifiable, you know, of things. Let's say on the risk factors, to define a risk factor, there is a difference between a risk factor and a cause. Because some people, they will think like when we're talking about risk factor, you are almost talking about the cause. But it's not actually the cause. It's what puts you at high risk in order for you to have a breast cancer. But a cause, it's something that you know, this is a causative thing that can cause, like a flu, whereby say it's COVID-19, it's a cause, you know, then you have to treat something. But breast cancer, we talk about the risk factors. Then on these risk factors, we've got these uncontrollable. Let's start about them. Let's say gender. You know, as I speak on epidemiology, you know, I said we've got about 90 plus 96% of females. You see, that means if you are a female, you are at risk. But it doesn't mean if you are a male, you are not at risk. You know, that's the first thing. As you are a female, you are already risk, you know, because in males it's about 1 something, about 999 or something. Then when it comes to genetics, you cannot do anything about genetics, you know, it's what you are born with. If you've got mutations like BRCA mutation, BRCA1, BRCA2, which is zizinto ezidip ke ngoku ezibonwa phaa, but zi-genetics zakho ezi, uyabo, akho nto uzoyithini, uyabo, because into oyidalelwe ngaphakathi, uyabo. There is nothing, you know, it's not easily modifiable, that thing. Then family history of this. You've got a strong family history of breast cancer, that means you are at risk of having it. And there is one thing we call, whereby there is you've been exposed to estrogen for too long. Estrogen is one hormone that is, they like females, it's a female hormone that is very good to them, but at some point, anything that is good, when you expose yourself too much, it becomes bad. We call it a risk factor of early menarche, whereby you start periods very early, and late menopause, whereby later, you are also at risk, you know, you're all at risk. Then they say, if you're in between, you break that estrogen and bring some progesterone effect there, you know, another hormone, whereby you are pregnant, you know, you get pregnant, and those people who become pregnant and have kids, and they're breastfeeding, they've got the risk factors becomes like a little bit, you know, a little bit. Yeah, that's what I can say. Then exposure into radiation, you cannot do. Then we say, I think I've already mentioned how to mitigate these things. You know, if you can having children, that means it's some sort of prevention somewhere.
So, doctor, what role does lifestyle play in breast cancer prevention, and what lifestyle changes can reduce risk?
Okay. You know, when we're talking about risk factors, you know, I only mentioned those ones we cannot do anything, because I knew there is this question. Lifestyle is one thing that we can do and we can practice. Obesity, like weight, which is you are obese. Obesity, that's the first thing. Second thing, alcohol. You know, drinking alcohol, smoking, it put you at risk. Then also there are people who likes to do these things we call hormonal replacement therapies. They also put you at risk, those things, you know. Then how to deal with them? Yeah. If you improve yourself into exercise, you cease your smoking, you start, when you exercise, there are so many things that are going to change. It also helps and in other things, and you also reduce on your alcohol intake. Those things can assist on also reducing your risk factors, which is the ones that are modifiable.
Okay. Doctor, thank you so much for such insightful information, and I also hope our viewers will do take this information into consideration.
Okay. Also the important thing, you know, there are these important things whereby you have to make sure that you examine your breast yourself. Make sure if you have any lump or any change, discoloration, or any something that is discharging in your nipple, become worried and you come and being examined by a doctor so that you can be referred into good places so that you can be assisted. We don't want people to come with a late breast cancer. We like people to come into early so that we can do clinical examination, we can do imaging, mammogram and ultrasound, and also we can do biopsies so that we can assist our people so that we can treat them. Thank you.
Well, there you have it, guys. All you need to know about breast cancer. I hope you guys do take this information into consideration and you seek the help you need. Until next time, bye.